this recording.
Okay, great. Okay, we'll wait for a couple more. Okay, I guess we should start. Good morning, everybody. I just wanted to thank JOWMA for joining us today, right? Jewish Orthodox Women Medical Association, right? I almost said alliance there. Okay, so we have a few physicians joining us this morning. I'm very excited about this panel. And I want to thank Dr. Bruck for putting it together. And I'm going to turn the floor over to her to start us off. Thank you.
Thank you. Thank you, Mrs. Segelman. Hi, everyone. My name is Efrat Bruck. I'm in my final year of medical school at the Icahn School of Medicine at Mount Sinai in New York City. I live on the Upper East Side of Manhattan, near my medical school. I'm originally from Brooklyn. You all hear me, right? Like it's clear and calibrated? I am originally from Brooklyn, New York, or if you know the area, from Borough Park. I went to Bissacoff Borough Park Elementary School, high school, Bissacoff Borough Park Seminary, the intensive program. After that, I went to Terrell College, and now I'm at Mount Sinai Medical School. I'm also the chair of JOWMA Premed, where our goal is to provide information, resources, and support to pre-med students, starting all the way from high school throughout the entire pre-med journey until you're hopefully accepted to medical school. I was actually a high school teacher before medical school, so it's really exciting to be back in this setting, but in a sort of new capacity as an almost doctor. So thank you for giving me this opportunity to kind of revisit my old haunts. If you are interested in becoming a physician, please go to jowma.org, become a member. We have lots of really exciting things for pre-meds. So we're going to start off with hearing from Dr. Hannah Weinstock-Neuberger, who actually has to go at 10:30, so kind of squeezed her in right at the beginning. Thank you so much for taking time to be with us, Dr. Weinstock-Neuberger. Let me introduce Dr. Neuberger to you. So Dr. Hannah Weinstock-Neuberger is a board-certified medical oncologist and hematologist specializing in genitourinary oncology, who's based in Baltimore, Maryland. She went to seminary at BJJ and taught in Bissacoff of Toronto, then graduated with high distinction from the University of Toronto before completing her medical degree at Albert Einstein College of Medicine. She completed her internal medicine residency at Beth Israel Medical Center and her medical oncology and hematology fellowship at the University of Maryland Medical Center. Since 2017, Dr. Hannah Weinstock-Neuberger works at the FDA, where she leads a team of oncologists in the review and approval of cancer drugs. She's also on the board of directors at JOWMA. So we had some questions submitted to us, and Dr. Weinstock-Neuberger is going to answer one of those questions. So let me pull up that question. So what's your advice to us as we make career decisions? Do you recommend your career as a good option for a religious Jewish woman? Why or why not? What type of person generally goes into this career? Which personality traits are helpful? Which talents and skills are necessary for success? What hobbies and interests do you have that are compatible with your field of work? How do reading, writing, and math skills come in handy? Without further ado, I'd like to introduce Dr. Hannah Weinstock-Neuberger.
Hi, thank you. So great to see you all. Yeshiva Greater Washington is actually near where I work, which is at the FDA, which is in New Hampshire, on New Hampshire Avenue in White Oak. But I live in Baltimore. So it's great to see you all. And I'm so honored that you invited me to be part of this. So those are a lot of really great questions. I'll see which ones I can answer. And I just want to start out with a disclaimer that you're welcome to email me. I will provide my email. I mean, it's hellohana@hotmail.com. That's the one I've had since high school, and it stayed with me throughout every, medical, university, medical. You can always reach me there, or call me, or, if I don't get to respond to some of the questions you might have. So I'm a medical oncologist. Currently, I'm not seeing patients. I work full-time at the Food and Drug Administration, approving new cancer drugs for genitourinary oncology, which means for cancers of the kidney, of the bladder, and of the prostate. I did have a continuity clinic even after I switched to the FDA at the Baltimore VA. But since the pandemic started, because most of the patients are elderly and have other medical problems, they've really switched to a mostly virtual encounter type of system with the patient's doctors. So, and the fellows who are training in the clinic. So it's been very hard for me to get kind of set up for that. So I just, especially because it's really, I only go into that clinic, for half a day, once a week type of thing. So I haven't done that since the pandemic started. But okay, so would I recommend my job for the average frum woman? So I have 4 kids. My husband learns in Neri Strahl full-time, and I think my job is amazing. I love what I do. I'm passionate about my work. I've had a lot of, Baruch Hashem, a lot of satisfaction from my job. I feel like what I'm doing every day is very impactful. I had an old friend who was in medical school ahead of me, as student Dr. Bruck and I both know we come from traditional Beis Yaakov backgrounds. Excuse me, I have a frog in my throat. Where medical school is not even really on the radar at all. But when I was considering a job option, I'm a high achiever. I love to learn, and I really wanted a job where I could channel that to what I do every day. And a friend of mine who was in medical school, she didn't come from a Beis Yaakov background necessarily. When I talked to her about job options, she said to me, you want to wake up every day and look in the mirror and love what you're doing and love going to work and believe that you're doing something that's going to make an impact. So I really took that to heart, because if I was going to be working so hard towards a goal, I wanted it to be something where I felt like I was contributing and using my abilities and talents, etc. So I do feel that what I do checks all those boxes every day. So to me, that was really important. If you're someone who loves to learn and loves to study and gets excited about reading about new ideas and new things, I think this is a really great job. The road to get to where I am is long, and you need to have a lot of perseverance and grit, and you need to be able to forego some things along the way. I remember missing my brother's Sheva Brachos because I had a final coming up, so I took off time for the wedding. But, I wasn't able to go to Sheva Brachos because that was just too much time away from studying. So, there are sacrifices. I was single for a long time. A lot of my single friends spent their single years, backpacking and exploring the world. And that wasn't what I was able to do. I spent my single years, in medical school. So I think it does take commitment. But at the end of the day, most physicians do make a good salary. So, there's definitely that perk where you're working really hard, but you're compensated well. And also, it's a very meaningful way of spending your working hours. So trying to think of some of the other questions you asked about reading, writing, math abilities. Those things are, I always love to write. I didn't want to be, I was thinking of becoming an editor or something like that, but I use writing every single day. We write reviews, we write, I publish, I write abstracts. I have to learn how to communicate with writing to different audiences. And I do that every single day. So all of my high school English comes into play almost every day. Sometimes I hear my high school English teacher, like in my mind saying, it's number, it's not amount, or some of the rules that came up, but I'm still using them every day. So I think if learning and achieving is something that you like, you'll bring all that to the table in your job. You also have to be very good interpersonally, managing a team, working with project managers, working with nurse coordinators, whoever it is. You have to be really good at, getting along, getting things done, but not, imposing your way. And working with patients, for sure, you have to know how to motivate people, how to have compassionate care, etc. So those are some of the things that I wanted to talk about.
Thank you. Thank you so much.
Sorry, who is that? Can you say her name?
Yeah, sure. Her name is Dr. Nomi Schnittman. She's a child.
Oh, sure.
She's awesome. And yeah, and there, you know, there are lots of good role models around you if this is something you're interested in. So, you know, take advantage.
Okay, thank you so much.
Thank you so much, Dr. Weinstock-Newberger, for taking the time to be with us.
I wish I could stay longer. I have a meeting at 10:30, so I'm gonna run, but call me.
Thanks so much.
Okay.
So I just want to give a brief outline of how we're going to do the rest of the session. I'm going to give a really brief presentation about some basic requirements for medical school. And after that, we have two more physicians joining us to answer some more questions for you. And then at 11, we're going to have an optional Q&A for those of you who want to stay. So I'm going to pull up my slides and share my screen. Can you all see my screen?
Yeah.
Okay. Okay, you all see my screen, right?
Yeah.
Okay. So, okay, I introduced myself already. We can skip this slide. So, what are the basic requirements for going to medical school? So these are some requirements that are almost universal across the board in the entire US. There are really only 4 things you need. You need a bachelor's degree, and you do not have to major in science. That's actually like a misconception that you have to major in biology or chemistry. You actually can major in anything you want. The second thing you need is there are a list of prerequisite courses that most people complete while they do their bachelor's degree, but you can actually complete it at any time. You can do it after. Like some people major in English and then decide to go to medical school, so they do these required courses later. I made a list of them. It varies a little bit from school to school, but those are basically the requirements that most schools will ask you to have. The third thing you need is the MCAT, which stands for the Medical College Admission Test. It's a standardized test that all pre-meds take. I think for most people, that's usually the most challenging part of the application. It's a pretty tough exam. And then the fourth thing is not an official requirement, but it's sort of self-understood that by the time you apply, you'll have some sort of collection of extracurricular activities. It doesn't have to be from college. It can be starting all the way back from high school. So those are the 4 things you need to go to medical school. So if you want to be a doctor, what paths can you take? There are actually 2 routes in the US. The first and more common route is the MD route. MD stands for medical doctor. Another way to see that is the allopathic route. But there's also another way to do it. You can go the DO route, or doctor of osteopathy route, or the osteopathic route. The reason that the DO route is a little bit less well known is because there are just less DO schools in the US. I think there are about like 150 MD programs in the US. There are only maybe 30 or 40 DO schools, so it's less common. But both of these are 100% legitimate routes to take to becoming a doctor. So I won't go through this entire slide. You'll have access to them later to read them. The one thing I want to point out is that when you apply to medical school, they'll see transcripts from every institution you attended after high school, including seminary. So if you're thinking of going to medical school and you're going to seminary and you're thinking like, oh, this really doesn't matter, it's only my college grades that matter, actually your seminary grades matter too, because they're going to see that transcript. So don't go in thinking like that this totally doesn't matter. I don't think you have to get like the most amazing scores in seminary. It's not nearly as important as college, but they do see your seminary scores. So this is something that I'm embarrassed to say I definitely did not understand this as a pre-med. I don't think I even understood this when I started medical school. You know, what does the timeline look like for becoming a doctor? Like where do the years go and why does it take so long? So I thought it would be important to kind of go through this. You have 4 years of college. After that, you have 4 years of medical school. There are some medical schools that do it in 3 years, but that's not common. And then this is kind of where I don't think I understood what goes on. When you finish medical school, you do a residency, which can be anywhere from 3 to 7 years. Then when you're done with that, you can do a fellowship. That's optional. That's like if you want further training in a particular field. And after that, you become what's called an attending physician. An attending physician means that you have completed your training, like you're sort of done. So what are you in each phase? So when you're in college, you're a pre-med student. When you're in medical school, you're a medical student or a student doctor. When you're in residency, you're called a resident, but you're a doctor then, right? You already have the letters MD or DO. So for example, in July, I'll be starting my residency, but I'll be a doctor by then. When you're a fellow in fellowship, you're called a fellow. And when you're an attending physician, well, you're just an attending physician. And the idea here is that when you're in residency, and also to some extent when you're in fellowship, you work as a doctor, but you have more experienced doctors supervising everything that you're doing. So just some key facts: at the very minimum, medical training takes about 11 years. That's starting from college. Until you're an attending, you work under the supervision of more experienced physicians who help train you. And a first-year resident has a special name called an intern. Examples, I won't go through all of them, but just, you know, let's pick like 2. If you want to become a cardiologist, for example, you have to do 4 years of medical school, 3 years of an internal medicine residency, and then 3 years of a cardiology fellowship. So 10 years starting from med school. If you want to be a neurologist, so that's 4 years of medical school, 1 year that's like it's called a preliminary or transitional, 1 year of like just general learning, and then 3 years of a neurology residency. Hold on, my slides are not moving. Oh, okay. What's the difference between a doctor, a nurse practitioner, and a PA? So I put this chart together. The doctors column is highlighted because we're a doctors organization, so that's what I'm going to focus on. But I think before we even touch this chart, the one thing that should jump out at you in the last row is the years of post-college training. So at the very, very minimum, a physician has 7 years of post-college training. Whereas if you look at the other careers, a registered nurse, a nurse practitioner, a PA, that's the minimum they have to have. They can have more experience, but in order to become that, all you need is, you know, those numbers. So what do doctors do? Doctors diagnose and treat diseases. They perform surgeries and procedures. What do nurses do? Nurses administer treatment plans and communicate with doctors. Nurse practitioners do kind of both. They do a doctor's job and a nurse's job. But the difference is that it's very location specific. In some locations, they have to work under the supervision of a doctor, and in some locations, they can work independently. So if this is something you're interested in, you might want to find out, like, you know, as far as your location goes, if you're able to work independently or not, if that's something important to you. And then a physician assistant can do anything a doctor does, but it has to be done under the supervision of a doctor. This is just a slide to kind of give you a sense of the amount of hours of training a physician gets in comparison to, for example, a nurse practitioner or a PA. Now, like I said before, PAs and nurse practitioners can get that experience as they move along, but a physician at the bare minimum will have around 15,000 hours of training under their belt by the time they're an attending. I won't go through this slide, but it'll be accessible to you later. I will say though that if you want to become a doctor, don't worry about the financial aspect. For most people, it ends up being a good financial decision. Many people ask me, like, how do I know if I have what it takes to go to medical school? I say there are really three things you need. You need some, some innate intelligence. You don't have to be a genius. You need to have the ability to commit to studying, and you need to want to become a doctor. I really think that if you have those three things, it's possible. And for those of you who are thinking, it's such a long journey, if you enjoy medicine, I promise you the journey is exciting and rewarding. I don't think you can become a doctor thinking just about the end goal of being an attending physician. I think to some extent you have to really enjoy the learning and training part. Okay, so that's it for my presentation. I would like to introduce our next two physicians. Dr. Gleepter, are you here? Thought I saw you.
Hi, let me just start my video.
Hi. Sure.
Hi, ooh, I don't know what happened to my background, but okay, I'm here.
No worries. Okay, I'm gonna unshare my screen. Okay, stop share. Hi, Dr.
My kids were
Gleepter.
playing with this. I don't know how I got that background. I think my kids were playing with it.
No
if it doesn't
worries,
bother
looks
anyone,
great.
I'll keep it, but while you're talking, I'll try to change it.
Yeah, so Dr. Gleepter, let me introduce her. She is a pediatric endocrinologist and a partner at Comprehensive Endocrinology in Bergen County, New Jersey. She received her undergraduate degree in neuroscience and biology from the Macaulay Honors College of the State University of New York. She graduated magna cum laude. She then went to Albert Einstein College of Medicine, received her medical degree with distinction in research. She completed her internship and residency in pediatrics at Rutgers, New Jersey Medical School, and her fellowship in pediatric endocrinology at the Children's Hospital at Montefiore Medical Center. Thank you so much for joining us, Dr. Gleepter. I'm going to head straight for our questions.
Sure.
So the first question for you is, what is your job all about? Take us through a typical day week at your job. What would you say are the pros and cons of your job? Describe the work environment. How interesting, exciting, or fulfilling do you find it? Is it competitive, high stress? What's the compensation like if you're comfortable sharing? Are there different varieties of your position? How much of what you do is interacting with people, technology, paperwork? Can you switch to a specialty later, or are you stuck with a ceiling on how far you can grow?
Okay, that's a loaded question. First, I want to start by saying thank you so much for having me. It's really an honor to be here and talk to you guys today. If you guys, again, want to get in touch with me after, I know this is a limited time frame, but I will give student Dr. Bruck my email. You can email me, call me if you have any specific questions after the event. So thank you. So obviously that was a loaded question. So just in terms of what my job is, so in terms of, the training that got here specific to me. So I did 4 years of college, 4 years of medical school. I did then 3 years of general pediatric residency. So that's, full pediatric training. I'm board certified pediatrician. So any pediatricians that kind of stop after that, they're general pediatricians. But then I did 3 additional years of training, which is fellowship, and I did that in pediatric endocrinology. And then once I finished that, I'm now a pediatric endocrinologist. So what that means, it's a lot of words. So I deal with hormones and in relation specifically to children. So I deal with growth, I deal with thyroid, puberty, diabetes, and all the different hormones and how they affect children all the way from newborn through age 18. That's kind of in terms of what I do. In terms of for me on a day-to-day, so in general, pediatric endocrinology is more of an outpatient field, and what that means is that I'm mostly in an office, seeing patients one-on-one, as opposed to other fields that are surgical, sub-surgical fields are in the hospital, and some other specialties are much more hospital-based versus outpatient. So I'm definitely more outpatient-based. I do sometimes see patients in the hospital as what's called consults. So if I have a patient who's getting, someone with diabetes and who's getting admitted, because they're getting acutely ill, then they're in the hospital and they have a team of doctors taking care of them in the hospital, but then I will come see them, as a specialist. Or if there's a patient that's not my patient that's admitted for some other reason in the hospital, but then there's some endocrine concern that is either new or that comes up when they're in the hospital, then I do go to the hospital, but primarily it's an outpatient kind of field. So for me, that is definitely something that I liked about endocrinology and about pediatric endocrinology. I like that kind of continuity of care. Like I have patients that I see, I like spending time with them in my office, 30, 45 minutes, an hour, speaking about them, hearing what they're, between them and their parents, what their, concerns are, how I can help them. To me, that's something that, that was, as I went through medical school, and it's not like I knew from when I was, 5 years old that I wanted to be a pediatric endocrinologist. It was kind of something as I saw through medical school, what the different fields were like. That was something that I personally liked more, outpatient medicine, where you spend more time with patients, develop those relationships over time. What else? What other parts of that question did I not get to?
It's fine. I think if it's okay, we'll move on to the next one, just because
Yeah.
we can kind of pack it in and
Yeah, they're all
as much as possible.
yeah,
okay,
definitely.
so the second question, what is your work-life balance like? What do you do outside of work? Do you have time for things that you want to be doing, juggling with family, things like family and friends? Are you able to get Shabbos and Yom Tov off easily? Are there part-time opportunities? Is it hard to detach when you get home?
Right. Also, obviously, a very loaded question. I mean, work-life balance is something, I can talk about for days. It's something that it's important for everyone. It's obviously, more highlighted in women, and especially from women. So I would like to say, yes, I do have a good work-life balance. What that means now and what that meant at different times of my training was definitely different. And like we said previously, it definitely involves, giving things up at certain times. But that doesn't mean that you're not having a good work-life balance if you're kind of doing it to achieve your end goal. So for me personally, I'm married with 4 children. I had my first child right before I started medical school. I had my next one in medical school, kind of at every stage of training. I had one in medical school, one in residency, and one in fellowship. So, definitely, at different times it was, more challenging than the next. But for me, it was always, I'm working towards my goal. And then when I was able to make choices to, facilitate more of a, being home more or having, a better schedule, than I would, but everything is, comes with missing something else. So everything is kind of a choice. So, one of those things, let's say for residency, so I chose to do a Shomer Shabbos residency in pediatrics. So, there's not so many of them left, but what that meant that I was guaranteed to be off on Shabbos and Yom Tov. It counted, the Yom Tov counted my vacation. It's not like I got extra vacation, but, scheduling is difficult and that was guaranteed. And for me, that was important both halachically, but also for my family. So as crazy as residency was, whether I was working days or nights or, 24-hour calls, like I knew I was going to be home from Friday night, through Shabbos. I may have to go in right after Shabbos. I may come home, like 2 minutes before candlelighting, but, I knew then I was home. So that was some stability for me. And then in terms of a job, so I'm now in a private practice where I have, control over my schedule. And that was something that was, very important to me to be able, my kids are still little, to be able to have, that flexibility.
Thank you. Thank you so much, Dr. Gleipter. That was excellent. Thank you.
Sure.
I'd like to introduce our next physician, Dr. Helman Ostrov. Are you here? I see her box. Dr. Helman Ostrov?
Yeah, I'm here. Hold on. A couple clicks
Hi.
away.
No worries.
All right, here we go. How are you?
Hi.
Good.
Hi. Oh, let me introduce you. So Dr. Mira Helman Ostrov is board certified in obstetrics and gynecology and gynecologic oncology. Like we mentioned, obstetrics and gynecology is a residency, and then gynecologic oncology is a 3-year fellowship. Dr. Helman received her medical degree at Downstate University Medical Center. She completed her residency in OB-GYN at Long Island Jewish Medical Center and did her fellowship training in gynecologic oncology at SUNY Downstate in Brooklyn. Dr. Helman's career has been focused on academics, and she's always taught medical students and resident. She's currently an assistant professor at the John Thurg Cancer Center and Hackensack University Medical Center. She instructs other surgeons in robotic surgery and functions as a surgical consultant for Ethicon Surgical. She's very active in research and is a primary investigator on several ongoing research projects. She is also on the board of directors at JOWMA. Thank you so much for being with us, Dr. Hellman. I'm going to pull up the next questions for you. So retrace your steps. How and when did you decide to go into this career? What factors shaped your decision? What practical steps have you taken since high school career-wise? How have they worked out for you? What experience or schooling do you think would be most useful to help someone make it in this type of career? How long and how difficult is the path to becoming employable in your field? Any recommendation as to how to pay for training? What types of continued education and training is needed for advancement in the career? Dr. Hellman, thank you.
Thank you. First of all, thank you for having me. It's a pleasure to be here. I am going to say that that was like question 3, 4, 5, 6, 7, 8, 9, 10, 11.
Yes.
Which is a nice way of putting it.
Pick what you want to, focus
on. One
on.
question. I do want to say a couple things. First of all, thank you for having me. Second of all, if you don't mind me commenting for a second on your presentation, just for 1 second, because it stuck out in my mind. I just wanted to point out you were, going over the differences between like advanced practice nurses and PAs and et cetera. One thing I did want to point out to everybody who's listening here, really depending on what you want to do, aside from the difference between advanced practice nurses and PAs having to work a lot of times, well, PAs always and APNs oftentimes under the auspices of a physician, I do also want you to realize and understand that the differences in training results in a significant difference in terms of patient management. Okay, so it's not just having to be under the supervision of somebody else. It also has to do with the fact that the reason they need to be under the supervision of someone else is because the training is severely curtailed and shortened. That leads to a much more superficial understanding of the management oftentimes, which is, trainable, and they're great, and it's a great career, but you have to realize understanding is the way you treat patients and the way you manage them is very different and based on a very different level of understanding. I just want to point that out over there. Sorry, nuance, but important nuance. Now, getting back to the 5 questions that you asked me, I'm going to pull them back up. Give me 1 second, because I don't want to go out of order of what you asked me.
I mean, you can kind of pick the things you want to answer. I know it's a lot. It's okay if you don't get to every little thing there.
No, I want to bring it up. I just I want to make sure that I'm answering it, at least touching on everything that you asked me. So just give me 2 seconds. Here we go. Okay. Where did my questions go? Okay, here we go. Okay. So I decided actually to become a doctor back when I was in high school, or maybe even a little bit before that. A lot of it had to do, for me personally, had to do with my father. He came from Israel. He didn't really have much of an education growing up. He went to Yeshiva, and he really wanted us to all be professionals and have a solid career, as opposed to him where he struggled a lot throughout his adulthood, trying to find jobs and various things like that. Obviously not for a lack of capabilities, but just for a lack of opportunities. So really a lot, for me personally, a lot of it stemmed from that. I always like biology, I always like the sciences, and usually these kind of sometimes things that doctors or medical professionals encountered never quote unquote bothered me or grossed me out, like examining people, touching people, saying things. So I always felt that it was like a good option for me, because it really suited what I was interested in and what I wanted my future to look like. Also, just as an aside, my father was a shochet, so I was oftentimes exposed to various things which maybe led to my surgical career. I don't know, but that certainly could have been somewhat of a background there. Let's see, practical steps. So it's interesting because I know, Efrat, you've done a great job in trying to guide people through getting into medical school, and your efforts are tremendous. I think to me, because I don't serve on a medical school admissions board, but I do serve on residency admissions board. One of the most important thing in getting into medical school is your academics. So grades, your college degrees, all that stuff is number one. Now, beyond that, in order to sort of help make it a little bit more diverse or ramp it up or whatever it is to increase the chances. Yes, there are other things that can help. Certainly forming a personal connection with a physician who can put in a recommendation on your behalf is certainly helpful. As a high school student, I volunteered in the hospital. Whether that made a difference or not, I don't really think so. Bottom line, again, it really boils down to making a personal connection with someone who can put in a strong recommendation for you, I think, is the bottom line. So whether that's research, whether that's shadowing someone in the office, I think that's the most important thing. And some people focus on shadowing. I don't think shadowing is extremely important at this stage because the medical knowledge that you gain from shadowing is somewhat limited. It may help a little bit in terms of maybe understanding the lifestyle that you're getting into, but more importantly than that, I think it's helpful in terms of establishing a personal connection with someone who can make a personal recommendation for you for medical school. So I think that's something important to focus on. But again, do not let that detract from your academics because that is the most important thing in terms of getting into medical school. Now, what experience or schooling do you think would be most helpful for someone to make it in this type of career? This type of career meaning medicine or this type of career meaning my specific specialty?
I guess let's focus on, well, you pick.
Okay. I mean, honestly, given who's listening, I think we should probably focus on medicine because most people going into medical school don't know what they want to do. And that's perfectly normal and proper and reasonable. So that's fine. But like I said, the most important thing to me is focusing on your academics and doing well in school and being motivated. Like you mentioned earlier, motivation, dedication is number one. You can be the smartest person in the world, you can have the best academics, but if you're not dedicated to this, it's not an easy course to go through. It is demanding, it's rewarding, but it's demanding. And if you're not dedicated, you're gonna have a very hard time. So I think the most important thing is to be dedicated. How long and difficult is the path to becoming employable in your field? So I will say that most people who go into medical school and graduate successfully from the residency will have job opportunities available to them. Unfortunately, I just found out last week that maybe PT Monk is not such a great option. But when you're choosing which field to go into in medicine, that is something important to focus on when you're in medical school. A lot of us, myself included, we go through medical school, it's like, oh, I love doing this, that's great, and we pick our career choice based on that. I think it's a little naive and it's a little immature. I did the same thing, and I don't regret it. I love what I do, but I think it's very important to focus also on what lifestyles will be available to you within the field that you choose, what the compensation's like, what the job market's like, because they don't teach you this stuff in medical school, unfortunately.
All like things that you're not allowed to talk about as a medical student, but are supremely important.
Exactly, which also goes back to forming a connection with someone in the medical field because it's a lot easier to find this stuff out if you know someone in medicine. I went through my entire medical training personally not knowing a single person in the medical field. So I think that, I did well in school and everything else was fine. So I got what I wanted, but did I have all the information I needed to make the best choice for me? I don't know. So I think it's important to realize that when you're choosing your path, you probably don't want to limit it just to what you enjoy doing on your rotations or your medical school exposure. Of course, that's the most important because if you hate what you do, it doesn't matter what else comes with it. You're not going to want to do it. But you should also be aware of what the lifestyle demands are like because there are drastically different lifestyles between different fields. There are fields that lend themselves to part-time careers. There are fields that lend themselves to working, only 3 days a week, even being full-time, as opposed to some fields where, your usual work week is 60 hours a week or whatever once you graduate. So it's really important to know what you're getting yourself into when you choose a field. So
is it okay if we move on to the next question? Just
go ahead.
Go ahead. Okay, thanks. So question 4, your advice to us as we make career decisions. Do you recommend your career as a good option for a religious Jewish woman? Why or why not? What type of person generally goes into this career? Which personality traits are helpful? What talents and skills are necessary? What hobbies and interests do you have that are compatible with your field of work?
Okay. So I think I kind of went into the 4th question already in terms of advice of making career decisions. It should be a broad decision, not honed into just like what you thought was cool when you were doing your rotations. What I do is very specialized. I'm a gynecologic oncologist, so I'm not a general OBGYN. In terms of it being a good choice for a Jewish Orthodox woman, that's extremely variable. It depends what you're willing to do and not willing to do. Like you stated earlier, just about any career choice that you make is going to have sacrifices. Okay, and it depends how much you are willing to sacrifice and how much you can work around it. I will say this: a career, if you decide to become a doctor, a career in medicine does require a lot of support. Social support, family members, nannies, whatever it is, you cannot do it alone if you plan to have a family with children. So as long as you know that you can establish support for yourself, you have to make the determination of how much you're willing to sacrifice or not. I will tell you just as a generalization, but again, not necessarily. Some of the surgical fields are more time demanding. So that's something that needs to be taken into consideration as opposed to fields that are completely office-based, where it may have a more workable schedule and maybe it may lend itself to be more part-time. Just as a little thing, radiology is, I think, it's a great field for a woman because a lot of radiologists do practice only 3 days a week or 4 days a week, very set hours, no emergencies, shift work. Jobs are shift work, I think, lend themselves to be a little bit more easy to work with a family life. That's not what I did. And like I said earlier, I have no regrets about what I did. I love what I do, and I would do it all over again. But as a practical point of advice, fields that are shift work tend to be easier to work with a family and with children, etc., stuff like that. But I definitely think it is doable as a religious Jewish woman. You just have to want it badly enough. And what type of person generally goes into this career? I would say hardworking, dedicated, intelligent. That's really what it takes. Which talents or skills are necessary for success? Persistence, perseverance, a little thick skin.
Grit.
Grit, exactly. And one thing that you have to realize, and I think a lot of us have a little bit of a rude awakening, you know, a lot of us go through high school or even college, putting in some effort, maybe not the most effort necessary, and then we get to medical school and we're slammed because we're no longer sailing through it without having to put in minimal or any effort. So that's also just something to realize. It's a little bit of an awakening that you realize you actually have to work, regardless of where you come from. You have to work to get through this. No one gets through this without doing work. Aside from one guy in my class who I think was like Asperger and a genius, and then actually didn't unfortunately end up matching for residency because he couldn't actually talk to people, but he got through all of his tests without studying. Which hobbies and interests do you have are compatible with your field of work? You can have whatever hobby you want. It doesn't have to be compatible with your line of work. I think it's important to have hobbies outside of your medical field, medical work, because it is so time demanding and so consuming. You need a little mental break for it. So actually, I think it's helpful to have hobbies that are completely not related to medicine. But you know, that's a personal choice. And how do reading, writing, and math skills come in handy? I mean, I can't do math. I had to Google long division the other day for my 4th grader. And I don't think it's interfered with my medical career. You know, obviously reading, writing, all that stuff is necessary to get through school. And reading, you have to do a ton of reading. Even after school, you have to keep up. You have to read your journals. You have to be up to date in terms of what you're doing, how you're treating patients. So that's definitely something that has to be, you know, very mature. I think, is there anything else I didn't answer here?
I think that was excellent. Yeah, I feel like you and Dr. Hannah Weinstock-Neuberger gave very different answers. You know, the answers were different, so that's great because I like when they hear multiple perspectives.
We should have coordinated this. That's funny. We should have coordinated.
No, but it was great. Thank you so much. I mean, we're going to do a Q&A, and if I don't know if you're able to stay or if you have to go, you're welcome to stay.
Give me 1 second. Let me check. I will tell you. No, unfortunately, I have 2 patients waiting, so I've got to go.
Okay. Well, thank you so much for your time.
My pleasure. All right.
We really appreciate it. Have a great day.
Thank you. With any questions that you have, okay? I'm always available.
Yeah, I'll pass on contact information at the end.
Okay, great.
Thank you.
All right.
Thanks, Dr. Hanostrov.
Bye-bye.
Thanks. Yeah, so I'm happy to move on to Q&A with myself and Dr. Galipter. However you guys want to do it, in the chat or saying it or really, you can ask us anything. I think, Dr. Leeper, do you agree? You can
Yeah,
ask us anything.
definitely feel free. I know that was like very, very quick overview, and all
Yeah,
the
very
questions were like
packed.
10 questions in one. So
Right, if I could just interject for a minute, I just want to let all the girls know that we know you have a break now. So if you want to go for your break, I know there are some of you who are very interested in medicine and may have questions. Those of you who want to go, please feel free to go. I want to thank all the physicians who were here, the physicians who are here for their time. And some of us definitely have some questions, but I do know some girls are itching to go. So I want to give them that opening.
Thank
Okay, I see a question in the chat. Yeah, do you want to speak, or okay, I can read. How do you make money and support yourself financially when you're in school for that long? Great question. So most people, or Dr. Leeper, do you want to take this question?
Sure. I would say, I don't know if this is what you were going to say, that most people, first of all, it's an important question. Like you said before, there's a lot of questions that people don't talk about. Money is one of those, but it's obviously something important that, you need every day to live. So I'd say most people take out student loans. Medical school is expensive. It's expensive. There's no way around it. And I would say there's some schools that have, let's say, either their own scholarships or, their own loans, but then there's, federal loans that I would say most people take. Just kind of, if you know that you want to go to medical school, there are kind of, let's say for my situation, so for college, I wanted to go to a more expensive college, and knowing that I wanted to go to medical school, my parents were, very smart to tell me that, if you want to go to an expensive college, and then, medical school is expensive. So I chose to go to the Macaulay Honors College, which was like a free, honors program. And I got a stipend and I didn't have to pay. So, in terms of, looking at my future, if I had to take out loans for undergrad and then for medical school, that would have been, at least for me, excessive. But so just kind of, if there's anything that you can think of, I know Stern College has their, certain scholarships for Einstein, that I know a lot of that changes over time. So I don't know the details about that, but there definitely are, certain things. But, the main thing is to know that I would say most people do take out loans.
One thing I want to add that you have to keep in mind is, so you have to pay for medical school, but then you also have to pay for like your living expenses.
Right.
And on top of that, there's something called, I don't know if you've learned this in economics, but an opportunity cost. So like that year, you're not working, right? It's sort of like you have to factor into account that you're losing the opportunity to work. But I will say that for most people, like I wouldn't worry about this too much now, because every single medical school has an entire office whose job, literally, they get paid to do this, is to help get you financially through medical school. Okay, there's going to be like 10 people sitting in that office who sit there every single day. And their job when they wake up in the morning is to help, whatever 500-600 students in that school to get through medical school financially. So I wouldn't let this like worry you or bother you. Like people are going to help you through it. We all do it. And then you could look at that slide I have, but an average physician salary, annual salary is like, 1 year's salary is usually enough to pay back your loans. So like, I just
I would actually disagree with that. I think that's something also that people don't talk about. Just there are fields, if you're a neurosurgeon, yeah, in your first year after training, you can probably pay back your loans. I mean, I'm not a general pediatrician. I didn't mean that you could
pay it in a year, right? You can't pay it in 1 year because you have to live, right?
Right. No, but even just like in terms of just not specifically just what you're saying, just the idea that, you're going to take out a lot of loans, and then like, don't worry, once you're an attending, you're going to make a ton of money and you're going to have like a great lifestyle and be rich. Like it's not, there are definitely doctors that, make a lot of money and have a great lifestyle. And I think that no doctor is, I think, after becoming a doctor, you have a lot of job opportunities. But in terms of like the sheer amount of money you make, and obviously it depends on, the field, neurosurgeon, radiologist, tons of other fields. I could just say for a general pediatrician, and even a lot of the pediatric subspecialists, pediatric endocrinology included, the salary is not that high. I mean, just obviously it ranges, but just, and I still, I picked what I do. I didn't know the numbers, but I kind of knew that idea, going into it. And like, I tried, in third year medical school, fourth year medical school, looking at other fields that, radiologists, I knew some from women that are radiologists, and it makes money and you have a good lifestyle, but like, I didn't like it. So you first and foremost have to pick what you like, what's going to make you happy to wake up every morning and go to your job. But just definitely something, to definitely keep in mind. And I feel like a lot of people don't talk about that. So just wanted to mention that.
Thank you for that. Good point.
Yeah, but it's not to scare anyone, and it's doable, and there's a lot of job opportunities, whether it's, like, some people work in the hospital, some people work outpatient, some people work, like the FDA, or in more, not the typical, patient-centered jobs, but there's so many. Any
Thank
other
you.
questions?
Yeah. Any other questions?
I'm just looking at the chat, but I think it's all the general.
Yeah, I put some stuff.
Yeah,
there.
okay, that you put in. I didn't see that. Okay.
Have a really quick question.
Say that again.
I don't know if I'm good.
No,
Rachel, why don't you type it? Why don't you type it in the chat?
Or they can talk. Okay. Whatever's easier.
Right. I think the sound in the room is not great because some
Oh,
people,
okay.
right.
Okay.
Some other classes are coming in.
Oh,
making
okay,
noise.
sure. No problem.
Can you make money while in medical school to support a family and have a side job or something? No, not really. Maybe a little bit of a side job during certain rotations, but no. And they take that into account. Like when you take out loans to help support yourself.
Yeah.
It's medical school it's more than 9 to 5. You're not going to have any time to make any sort of generate any sort of real income. No.
Yeah, I agree.
Yeah, you agree, Dr. Gleaser? Anything to add?
No, I agree. I mean, medical school is really intense. Like Dr. Helmut Ostrov said, you go from, if you're generally smart and hardworking in, high school, college, you can get by without studying as much, but then you're putting all those people into a medical school class. And then, it's a lot of work. So maybe here and there you can do something small, but nothing that's going to make a meaningful impact on your financial situation and not worth probably the time that it's going to take away from, studying and rotations or, whatever it may be.
I feel like whatever little time you have left, you're going to need for yourself to rest, recharge, and be a normal human being.
Totally.
Like I would not take those precious few hours left and try to make money. Just take a little extra loans and be a normal human. We do have another question. How do you go from seminary into a college medical school environment? Is it a really scary place to be? What an excellent question. Dr. Gleaser, you can go first and then I'll ask you.
I mean, so for me, I grew up modern Orthodox. So, for me, I wanted to go to a secular college. Personally, I didn't want to go to Stern. I wanted to go to a secular college. So, I commuted I was at Queens College with my, where I was. So I commuted, I didn't, dorm. So for me, it wasn't so much of a transition. And then for medical school, I went to Einstein, so it definitely is, there definitely are a large percentage, larger than other schools. Still, most of the people are not, from, but there definitely are a lot of from people there. So, there's always, a group on Shabbos and things like that. But so for me, I didn't really have that so much of a transition. I don't know. Background's a little different than mine, so you probably can answer this better.
It's
interesting.
I come from a very Beis Yaakov type of background, but I didn't go to medical school right after. I didn't even go to college actually right after high school because college, wasn't really on the radar. The school that I went to, the expectation was actually for you not to go to college. So I will say that I had my kind of own life transition. By the time I went to medical school, it wasn't really an issue. I would say, wherever you are, you can always try to find yourself a support group. It's always harder to do something by yourself than it is to do it with other people. So whether it's college or medical school, you'll find your few people. I think JOWMA is a great resource for this, because you're going to find other people like you who went to every school, all the way from like Hasidic schools that don't teach English to schools like mine that don't want you to go to college and don't sort of let you take the SAT and things like that. And then more liberal schools that allow you. So you're going to find people like that who can be your support network and help you through it. So that would be my answer. Is it scary? No, I don't think it's scary. It might challenge you or test you, but if you have a support system and you know what you want, and you have mentors, I'll add that too. I think it's very, very doable and very possible. And I'm at Sinai, where there are Jewish people, not as many as Einstein for sure, and there are not a lot of firm people here. But I had a very, very fortunately great experience here. So for me, that part was not an issue at Mount Sinai.
Okay,
Any other
thank you
questions?
so much.
I know that we're like 2 minutes left, so we
Right.
can either wrap up or take questions.
So it looks like everyone except Rachel left, and Rachel got her question answered. So I think it's time to
Okay,
wrap
great.
up.
All right.
But this was really, really wonderful. Thank you so much.
Thank you for having us.
Sure, thanks for having
Sure.
us. And I'm gonna email you, I'll send you an email with everyone's contact information, including how to
Perfect.
get in touch with JOWMA for
Yeah.
people who are gonna do pre-med, where we're really, really happy to have them on board with us.
Yeah.
Okay, perfect. Thank you very much.
All right.
This was
Thank
really
you.
wonderful.
Have a great day.
Take care.
All right. Take
Nice
care.
meeting
Bye-bye.
both of you. Take care.